Botox. It's the most popular cosmetic treatment in the world. Maybe because it's a bit magical. A few injections, facial muscles relax, wrinkles disappear. This makes it a very addictive treatment. So much so, I would say most people who have it once end up having it regularly for life. And you don't really want to stop having it once you start. But as you know, due to the coronavirus, many of the cosmetic clinics are or have been closed, meaning that people have been missing out on their treatment. There's even been a meme going around about the Kardashians missing out on their regular Botox treatments. But you don't have to be a Kardashian to miss out the effects of Botox treatment. It would be quite devastating to have those wrinkles that you are used to being gone come back. But there's something else that may be stopping us from enjoying the wrinkle-reducing effects of Botox, and that's our immune system. Our immune system is here to protect us from harm from bugs from the outside world. It produces antibodies in response to viruses or bacterial toxins to protect us by providing us with immunity from future attacks. And since Botox is a bacterial toxin, then is it possible that our immune system will defend us from it? Is it possible to build immunity to Botox? This would be highly undesirable, especially given the nature of Botox is to have it done every 3 to 4 months. But why is it that you may not have heard of this problem of immunity before? And why do so few practitioners worry about it? Here's what makes it confusing. It's rare for Botox not to work at all, but it's not uncommon for it to work partially. Maybe it worked, but not completely as expected. If you've had Botox, you probably have had this experience yourself. Maybe there was just a little bit too much facial movement afterwards, or maybe it didn't work as well as it first did, or it didn't last as long. When this happened, I often blamed myself rather than the Botox. Maybe it was the positioning of the injections, the depth, an inadequate dose. It sort of reminds me of that episode of Seinfeld where George gets out the, it's not you, it's me routine.
You're giving me the it's not you, it's me routine? I invented it's not you, it's me.
But I'll be the first to admit that despite practicing cosmetic medicine for 15 years, I've spent most of those years in denial myself about the possibility that my patients are becoming immune to Botox. Until I came across a small handful of patients who, despite topping up their Botox, despite doubling the dose, despite multiple attempts at trying to get their Botox to work, nothing happened. It didn't work at all. Their muscles fully contracted afterwards. This woke me up to the fact that immunity to Botox is a real problem. Although the number of completely resistant patients over 15 years I could count on the fingers of one hand, it made me think, what about those who are partially resistant? The only way to know if you are developing a degree of resistance or partial resistance or immunity against Botox is to do a blood test to detect neutralizing antibodies. The only place I could find in the world to do this test was a place in Germany called Toxin. I actually emailed them with the view of sending them samples from my patients to test. Financially, it was very costly, and the feasibility of sending blood up there was low due to the fact that you needed cold storage transport. So for those where the Botox isn't really working as well as we expect, we can't just do a test for the antibodies. Well, not very easily from here in Australia anyway. And as a whole, we can't easily determine the percentage of patients who develop neutralizing antibodies with Botox treatments because of the difficulty of testing everybody. That's why this study of the formation of neutralizing antibodies by Professor Philipp Albrecht, done in Germany with access to the Toxin labs, is a significant study. And he showed that basically 13% of 596 patients of those treated formed neutralizing antibodies against the botulinum toxin when used for neurological conditions such as blepharospasm, cervical dystonia, facial hemispasm, spasticity, and dystonias. There are some neurological conditions used in the Albrecht study that are very, very similar to the cosmetic treatments that we perform. Blepharospasm, or twitching of the eye muscle, are very, very similar to crow's feet treatments for wrinkles with similar dosing. So it is likely that resistance is an issue with cosmetic Botox as well as Botox for neurological concerns. To unravel the underlying causes of immunity to Botox, let's look at the bacterial toxin more closely. In Australia, there are 3 brands of botulinum toxin. Two of the three brands, Botox and Dysport, have not only the active part, the neurotoxin, but also have an associated complexing protein, which are not involved in the function of the botulinum toxin itself. With Botox and Dysport, the complexing proteins that come with it are actually a risk factor for developing immunity. They often trigger the immune system, leading to the formation of antibodies, both to the complexing protein and the active neurotoxin, rendering the treatment ineffective. But more recently, over the past few years, a third brand of botulinum toxin has become available in Australia. It is Xeomin, it's purified, and it does not contain complexing protein. I've been fortunate enough to be able to talk to the inventor of Xeomin, Dr. Jurgen Frevert, scientist and botulinum toxin expert who has a long experience with botulinum toxins. He's the inventor of Xeomin, the purified botulinum toxin without complexing proteins. So we're going to ask him what the purpose of the complexing proteins were and why they were contained in certain botulinum toxin products. And what are the advantages of having a botulinum toxin without these complexing proteins? So thank you, Jurgen, for being a part of this talk. You're often nicknamed the godfather of Xeomin. That's because you're the inventor of Xeomin, which is the botulinum toxin, which is purified, free of complexing proteins. Now, maybe you could tell us a bit about what led you to create this botulinum toxin.
Well, in 1990, I became an advisor, consultant to the company Allergan. Allergan was interested in my work because I was a specialist and am a specialist in botulinum toxin. But at that time, Allergan didn't have much experience with proteins, with biologicals. So they approached me and I became a consultant. And I learned that Botox is based on the botulinum toxin complex. That means not only the active substance, the neurotoxin is in Botox, but a lot of different bacterial Clostridium proteins called the complexing proteins.
Now, why do they put them in there? I mean, I don't understand this. From my understanding, it's not a necessary part of the botulinum toxin. It's not an active part. Why are there these complexing proteins?
Yeah. To go a little bit back to the basics, the Clostridia produce the botulinum toxin complex for the special purpose. Maybe you know that botulinum toxin is a food poison.
Yes.
If you eat rotten meat, for example, or vegetables which are contaminated with Clostridium botulinum, you can get an intoxication. But interestingly, botulinum toxin, you know that is a protein. And proteins, like the proteins in the meat, vegetables, and so on, they are degraded in the stomach and the intestine. And that's why the Clostridia, so to speak, invented the complexing proteins to protect the neurotoxin against degradation in the stomach and the intestine.
I see.
That's the reason why there is a botulinum toxin complex for oral bioavailability. But in therapy, the complexing proteins do not have any function because what's working when patients are injected into the muscle is the neurotoxin itself. The neurotoxin is taken up by the nerve cells and then inactivate, so to speak, the nerve cells, paralyze the nerve cells.
The complexing proteins do nothing in terms of the activity of botulinum toxins. So my question to you is, if this is the case, why has it taken us so long to get to this point where manufacturers are only now, or only since you invented Xeomin, only since then have we decided to make a purified toxin? Why hasn't this been done from the beginning? What do you think the reasons are?
The thinking was that the complexing proteins are necessary for the stability of the neurotoxin. It was thought that the neurotoxin is a very labile substance, which is immediately degraded, denatured after dilution, after formulation, after drying. And that's the reason why Allergan stick to this botulinum toxin complex. And the other reason was that a good colleague of mine from, so to speak, from Allergan mentioned that, well, the neurotoxin is too sticky. It sticks to the walls of the vial or to tubes or syringes. So the complexing proteins are necessary to protect the neurotoxin against degradation and against sticking. But that was not my opinion. I was pretty sure, I was convinced that it is possible to develop a new toxin without the complexing proteins. And in the end, we found an optimal, as you know, formulation which really stabilizes the new toxin so that Xeomin, and that's the only product on the market, Xeomin is stable at room temperature. Okay. So it's really possible to develop a new toxin without the complexing proteins. The complexing proteins are absolutely useless.
So when you created Xeomin and you found that it didn't stick to the vial, it was stable, did you have to create that first, or did you sort of know already that it was going to be stable and not stick to the vial without these complexing proteins? I mean, how did you envisage that?
Well, this was, of course, my thinking. I was an optimist, so to speak. Yeah. I worked with a new toxin, and I thought, well, I know everything about the new toxins, so I was really convinced that I will develop an optimal formulation for the protein and prevent sticking and so on. It was, of course, a speculation, but in the end, I was successful. My optimism was justified, so to speak.
Amazing. So really, given that the other botulinum toxins have protein, but Xeomin is the only botulinum toxin without protein. So if that is the case, and as doctors, how can we sort of ethically justify giving our patients a botulinum toxin with protein in it, knowing that it will likely or have some chance of causing some degree of immunity? What are your thoughts on that?
From my thinking, it's not really justified to inject complexing proteins which have no function in the mechanism of action, which have no function at all in the therapy of botulinum toxin. Why inject patients with unnecessary proteins which are not an advantage for the patient?
Yeah, for sure. And I understand that you're from doing a bit of research about yourself. I understand that you yourself have actually vaccinated yourself against botulinum toxin. So
exactly, I'm vaccinated because that was required by my employer when I started with botulinum toxin, because I worked with extremely high doses, millions of units per ml or per cc. So it was requested that I became vaccinated.
Right.
And I developed a very high titer. And so, look at my glabellar lines. You can inject 1,000 units. Nothing will happen because my antibodies will neutralize the units which are injected into my corrugate or procerus or wherever you inject.
So it goes to show that botulinum toxins, it can act as a vaccine, whether it be purposely or whether it be unintentionally, like when we're treating frown lines, forehead lines. Exactly. In the aesthetic field, for example.
Exactly, and that was our thinking in the beginning. When I started with botulinum toxin in the therapeutic field, we knew that at that time a lot of patients treated with Botox developed antibodies. About 15 to 20% of the patients developed antibodies. And so our thinking was, develop a pure new toxin so that would prevent the development of antibodies. And in the end, we were right. Until now, there is no secondary non-response due to antibody formation. You know that when patients develop antibodies, neutralizing antibodies against the product, it is not possible anymore to treat these patients because the antibodies grab, so to speak, the neurotoxin and prevent the uptake of the neurotoxin by the nerve cells. And so until now, there is no secondary non-response with patients treated with Xeomin, with a pure neurotoxin.
So to date, what you're saying is there's no recorded cases of non-responders from Xeomin due to neutralizing antibodies. No one's ever had a case.
Exactly.
Wow, that's phenomenal.
I must stress naive patients, because some patients who were treated with Botox or Dysport before, they had developed antibodies against.
Right. Okay. So Once you develop antibodies to one botulinum toxin, Botox or Dysport, for example, can you then go on to have Xeomin, and why will it work or not work?
Well, the thing is that the antibodies, the neutralizing antibodies, are directed against the neurotoxin.
Yep.
And the patients develop antibodies after treatment with the Botox or Dysport, antibodies against the neurotoxin, the active substance.
So it doesn't matter. You'll be immune to all of them. Once you're immune to one, you're immune to all of them, is what you're saying.
Exactly, because the neurotoxin in Botox, Dysport, and in Xeomin and all the other products, the type A neurotoxin is very similar. Generally, it is not possible to treat patients who have developed antibodies. You have to wait some time. And there is a discussion how long you must wait until the antibody titer decreases over time.
So if someone does become immune to botulinum toxins over the course of their treatment, how long is the average time before that neutralizing antibody titer drops? What is your experience with that? How long does someone have to wait before it will start to work again?
That is complicated to answer. The reason for that is it depends on the concentration of the antibodies, on the height of the titer. If you have a high titer, it takes a longer time until the titer is low enough to inject. If the patient only develops a small titer, it takes a shorter time. So there are a couple of publications in cervical dystonia patients. Some patients could be treated after 2 years, some patients after even longer time. The injection of Xeomin in patients who have developed an antibody titer does not increase the antibody titer.
Yes.
So it's safe to speak to test the Xeomin, for example, after 6 months, for example.
Yeah, without making it worse, without making the antibody titers raise again. Excellent. I think that's all I need, really. But I'd like to thank you for your time. Thanks for your knowledge, for sharing your knowledge and your experience. Maybe I'll see you at the next conference.
Okay, fine. Looking forward. Thank you very much. It was my pleasure.
Yeah, excellent. So unless you want to have the occasional break from your botulinum toxin treatment every once in a while, it's better to use a botulinum toxin that is purified, free of complexing proteins, to help reduce your risk of immunity to the treatment. Because of the need to repeat botulinum toxins in the long term, it's all about consistency. And it's about being able to count on the fact that you can have your botulinum toxin treatment and allow it to work for years or a lifetime. We can't test for the presence of antibodies or immunity easily. So this is the reason why prevention is much better than a cure.